let's talk about how to use an AED, because hundreds of people are alive today entirely due to the prompt and appropriate use of a defibrillator. For every minute's delay in deploying a defibrillator, the odds of survival reduced by about 10%. So in this video, we're going to look at adult CPR as a sole rescuer, meaning you're the only one there, but you've got an AED located nearby. And we're going to remember the acronym from previous videos, our primary survey. Danger, response, airway, and breathing. They're not going to be breathing, so then we must make sure we activate the EMS, we do CPR, and we get a defibrillator to them. And that was all part of the chain of survival we talked earlier about. Early access or the activation of the emergency medical services, beginning CPR, getting a defib to them, an AED, and then early advanced care. And if we can do all that in a timely manner, the chances of survival are hugely increased for this casualty. Okay, so the first thing we're going to do is D for danger. We're looking, we're listening, we're smelling for things that could be dangerous. We're approaching the casualty from the feet, and we're making sure that we talk to them. We ask their consent. Hi, my name is Emily, I'm a first aid, I'm here to help you. We'll see if they respond, we'll give them a bit of pressure on their shoulders, and maybe make a loud noise to see if they respond. There is no response. So then I do A for airway. I open the airway with a chin lift and a head tilt. And then I look, listen and feel for breathing for up to 10 seconds. So I'm looking at their chest rising and falling. I'm listening with my ear and I'm trying to feel for breath on my cheek. Now this casualty is not breathing. So I leave the casualty now and I go and call the emergency medical services and I make sure I grab the AED because there's one easily located that I can get in a few minutes. I return with the AED. The first thing I do is open it up and turn it on because it's going to talk to me. It's going to tell me exactly what to do. I'm then going to make sure I'm wearing the correct PPE. So I'm going to get my gloves on in this case. I'm then going to follow the instructions.
Apply pads to patient's bare chest.
The first thing I need to do is have a naked chest. So I need to remove the clothing off this casualty. So I'm going to unzip the jacket and then I'm going to use the scissors and place a cut at the top of the t-shirt. Might try and rip it. That doesn't work. I will then keep cutting all the way down. Remember, neck down to belly. I'll make sure that they're not hairy, and if they were hairy, I need to shave them where the pads would go. And maybe dry them if they're very clammy or sweaty. I'll get the pads out of the packet. I will have a look at the pictures on the pads because they do show you where you need to put them. Unpeel them because they're a bit like plasters. Stick one on underneath the right clavicle and the other one underneath the left pectoral muscle. There should be a hand's width distance apart between the pads.
Plug in pads connector next to flashing light.
You will then plug it in to where it's flashing and you follow the rest of the instructions.
Analyzing heart rhythm. Do not touch the patient.
Making sure that everyone's standing back, nobody's touching a casualty, because if someone is touching them, reading will be incorrect. It will analyse your reading rather than the casualty's reading. Now remember, it's looking for a shockable rhythm.
Shock advised. Charging. Stay clear of patient.
Tell everyone to stay back, so I say clear.
Deliver shock now. Press the orange button now. Shock delivered. Start CPR.
Then begin CPR. So I'm doing 30 compressions with 2 rescue breaths. When the shock's been given, you continue with CPR as directed by the machine, and you keep going with 30 compressions to 2 rescue breaths. The machine will reassess the heart rhythm, normally every 2 minutes, and they'll advise another shock if indicated, or they might say no shock advised. Please, if it says no shock advised, just continue with CPR and follow the prompts. Keep going until help arrives. And only stop CPR if the casualty begins to regain consciousness or until you become too tired, you can't carry on and there's no one else there to take over from you. Let's talk about what we'd do then if there was a helper there with us. What would we do? Well, quite simply, One person will begin the CPR straight away, because remember we talked about that being really important in the chain of survival, while the other person goes and calls the EMS, and then they will make sure they grab the AED. When that person comes back, they will take over the AED while you carry on with compressions.